Well, time now for the Africa Health Network. Joining us now is Africa 54's Linord Moudou. Welcome, Linord.
Hello, Vincent. Hello, everyone. Howard University is a historic black university in Washington, D.C. The school has been working in Africa on various medical projects, including capacity building and training doctors and researchers in addressing prevention and care of HIV/AIDS. I spoke to Dr. Anthony Wutoh, the Dean of the College of Pharmacy, about one of the programs.
Howard has been involved in projects in Africa for decades, but these specific projects in terms of training scientists, physicians, pharmacists to address the HIV epidemic has been about 10 to 12 years.
Can you give us a sense briefly of what the program is?
We have several projects in Africa. In Nigeria, we're conducting a project in collaboration with FHI 360 to educate pharmacists and other healthcare providers about HIV treatment and prevention. And then in Southern Africa, we have a number of projects in Tanzania, Rwanda, Zambia, where we're targeting the trucking routes that were a large contributor to the spread of HIV, to provide, again, training and education and help in the dissemination of antiretrovirals to address the spread of HIV. And then also in South Africa, we're involved in a project in collaboration with the Ministry of Health in South Africa and the University of Pretoria to help them identify individuals who are HIV infected but haven't yet met the criteria for antiretroviral treatment. Oftentimes those patients get lost to the system, so by the time they're eligible for treatment, they're unable to identify them.
What do you see as the common perhaps challenge?
Well, the drugs had traditionally been very expensive. These, because HIV is a relatively new disease, there really weren't a lot of drugs that had been developed to treat the illness. And so a lot of the new drugs that had become available, the protease inhibitors, the reverse transcriptase inhibitors, were relatively new classes of drugs. And so the cost of research and development and the cost of making these drugs available was very prohibitive. Certainly since generics have been made available, the cost has decreased dramatically. And with the manufacture of these drugs in countries such as India and China, the cost has also been brought down by several levels of magnitude. But to a developing country where the annual income may be below $1,000. Even when the cost of ARTs was brought down from $20,000 to $30,000 to $200 to $300, that's still a very prohibitive expense for a family that may not make $1,000, $2,000, $5,000 in a year. So access to antiretrovirals through PEPFAR and through other international programs has made a dramatic improvement in terms of individuals being able to access these drugs throughout Africa and Asia.
Do you think that there is enough resources and manpower to produce ARVs in Africa?
One of the projects that we're very interested in and that we've been working intently towards has been a collaboration between Howard University, Purdue University, and St. Luke's Foundation, Kilimanjaro School of Pharmacy in Tanzania. We've been able to build a small manufacturing facility that is actually been in the process of manufacturing small amounts of antiretroviral drugs. And the purpose of that project is to train African scientists in the manufacture of antiretrovirals, and also provide training in terms of regulatory processes, how to assess the quality of drugs, how to make sure the process by which they're manufactured is up to the standards where you can assure the quality and the health of individuals. So the overall goal is to ultimately provide the capacity for African countries to be able to manufacture within Africa antiretrovirals and other drugs of importance.
How long do you think this process will take, going through the training and then getting all the needed resources to actually manufacture these drugs?
One of the things that we found is that there's actually quite good capacity in a number of countries in terms of the technical training of scientists in Nigeria, in Ghana, for example. And so what was needed additionally was training we could provide in terms of regulatory processes and the expertise of some of our scientists like Joseph Fortunac, who was the lead in that particular project and who has had extensive experience as a research scientist in the pharmaceutical industry. So being able to lend his expertise and the training of expertise of faculty and other collaborators at Howard and Purdue and other institutions really has the potential to make a vast impact.
And that was Dr. Anthony Wutoh, Dean of the College of Pharmacy with Howard University in Washington, D.C. That's our Africa Health Network report for today. For more health news and developments, well, be sure to visit our website, africahealthnetwork.com.